Rabies, also known as hydrophobia, has been documented throughout history. The earliest cases were documented in 300 BC, but rabies was not officially recognized as a disease until 1804. It is classified as a viral brain disease and is usually fatal if not treated. It is also called hydrophobia because people and animals that have rabies have a severe aversion to water. Rabies causes the victim's throat to hurt tremendously, which makes them unable to drink water. Furthermore, the mere sight of water can put the victim into convulsions. Pain in the throat is just one of many symptoms of rabies. Early symptoms could be assumed to be caused by any other sickness, as they are low-grade fever, headache, loss of appetite, vomiting, and diarrhea. As the virus progresses, painful spasms, difficulty breathing and swallowing, dilated pupils, drooling, and an increased flow of tears and perspiration will occur. Finally, the victim may begin to feel excited, confused, and sensitive to bright lights, loud noises, and touch. In addition, the victim will become very thirsty but cannot drink, which leads to dehydration and loss of muscle tone. The incubation period for humans is 1 to 3 months. Once an animal or person has developed full-blown rabies, the chance of recovery and survival are very slim. Another way to get rabies is through an infected organ transplant. There was a recent case where 3 patients contracted the disease through infected organs. In addition, the disease can be contracted through inhalation, but this is very rare. Within the symptoms of rabies come 2 distinguishable types. There is the paralytic and the furious type. The paralytic type has a period of excitement followed by uncoordination, paralysis, dehydration, and finally death. Paralysis starts from the bite wound and travels through the body until it reaches the heart and lungs, at which point the victim dies. The furious type is characterized by altered behavior such as restlessness, hiding, depraved appetite, unprovoked biting, aimless wandering, excessive salivation, altered voice, paralysis, staggering, and finally death. And this type is more common in animals, and that's what most people think of when they think of rabies. Most victims of rabies are wild or domestic animals such as dogs, cats, bats, skunks, raccoons, and foxes. Smaller animals such as rodents generally do not carry rabies because the bite from another animal in which they would contract rabies is generally severe enough to kill them. The most common cases of people being bitten are by rabid dogs. Age and sex do not play any major role as to who is most affected by this virus, as the contraction is completely random. Jobs or activities that put a person into contact with wild and domestic animals are at a higher risk of contracting the disease. Rabies is prevalent throughout the world except for Greenland, Iceland, Norway, Finland, Sweden, Australia, and the southeast part of Asia. Within the United States, some states and cities are rabies-free as well. This is not due to any natural cause. The places that are now rabies-free have made a determined effort to eradicate it. This is done through preventing the spread of rabies in wild and domestic animals as well as humans. Every year there are about 15,000 cases of human rabies around the world, but thanks to modern medical innovations, very few people who have access to treatment die of this disease. Only one or two people a year die from rabies in the United States. Worldwide, the number is bigger due to more people and lack of medical treatment. Prevention methods include being vaccinated, medicated, and educated. Vaccinating any pets a person may own prevents the chance that person's pet could bring it into the house. Louis Pasteur invented the first vaccine for humans in 1884, which greatly decreased deaths from rabies. Since then, the process has improved so it is less painful and requires less shots. Although there are many medical ways to prevent rabies, most of the ways to prevent the contraction of rabies comes down to using common sense and being educated. These things include not petting wild animals, not interfering in fights between animals, making sure wild animals do not get into one's house, and being informed about the prevalence of rabies in the area in which one lives. To stop the spread of rabies, the community needs to make an effort to prevent new animals and people from getting rabies and finding those that already do have rabies. In this way, the disease will die out because it will have no new victims. The United States has a rabies problem along the East Coast. Raccoons in Florida have slowly been spreading rabies up the East Coast. The spread of rabies is in a 5-year loop in this case, as an area infected with rabies will become immune and most of the carriers will die out. Then, new animals will become infected, creating an upsurge in the number of infected animals. Although few people die from rabies in the United States, it costs a lot of money to pay for vaccination and prevention methods. In addition, in other parts of the world where people cannot afford the medicine, rabies is a life-threatening disease. New York itself spent $2 million in 1990 to fight rabies. To sufficiently try to control rabies worldwide, $3 to $4 billion would be needed. This money would treat those people and animals that are currently infected, as well as making sure no new victims are affected by this disease.